Hey everyone, if you're over 60 or caring for someone who is, this video could be life-saving. Did you know that over 100,000 older adults are hospitalized every year because of dangerous drug interactions? And you might be surprised to hear that many of these dangerous interactions start with something seemingly harmless. Food. That's right, what you eat can have a huge impact on how your medication works. In this video, we're diving deep into 5 common fruits that can turn your meds into poison, literally. We're talking about fruits you probably have in your kitchen right now. Bananas, grapefruits, pomegranates, oranges, and apples. I know it sounds crazy, right? These fruits seem so innocent, even healthy. But when mixed with certain medications, they can lead to heart rhythm problems, internal bleeding, kidney damage, and even death. We're going to break down the science behind these interactions and give you the knowledge you need to stay safe. Stay tuned! Let's start with a fruit we all know and love, the banana. Bananas are not just delicious, they are also packed with essential nutrients that our bodies need to function properly. They're a great source of potassium, which is essential for healthy blood pressure. Potassium helps to balance fluids in the body, supports muscle function, and maintains a regular heartbeat. But here's the catch. If you're taking certain blood pressure medications, especially ACE inhibitors or potassium-sparing diuretics, you need to be cautious. Eating bananas can actually be dangerous. These medications work by increasing the levels of potassium in your blood, which can be beneficial for managing blood pressure, but also risky if not monitored properly. Now imagine adding even more potassium on top of that by eating a banana. It might seem harmless, but the consequences can be severe. You could end up with dangerously high potassium levels, a condition called hyperkalemia. Hyperkalemia occurs when there is too much potassium in the blood, disrupting the normal electrical activity of the heart. Hyperkalemia can cause a whole range of symptoms, from muscle weakness and fatigue to irregular heartbeat and even heart attack. These symptoms can escalate quickly, making it a medical emergency. In severe cases, it can be fatal. Immediate medical attention is required to manage the condition and prevent life-threatening complications. Now, I'm not saying you can never enjoy a banana again if you're on these medications. Bananas can still be part of your diet, but moderation and medical guidance are key. But it's crucial to talk to your doctor about how much is safe for you. Your healthcare provider can offer personalized advice based on your specific health needs and medication regimen. They can help you determine the right amount of potassium you need based on your individual health conditions and medications. Remember, knowledge is power. Being informed about your health allows you to make better choices. Understanding how your food and medications interact can help you make informed decisions about your health. This knowledge can prevent potential health risks and improve your overall well-being. And speaking of interactions, let's move on to our next fruit, which can have some pretty surprising effects on a wide range of medications. Stay tuned to learn more about how what you eat can impact your health in unexpected ways. Grapefruit. It's a fruit that many people enjoy for its refreshing taste and health benefits. It's tart, it's tangy, and it's a staple in many breakfast routines, and it's packed with vitamin C, which is essential for a healthy immune system and skin health. But did you know it can also amplify the effects of certain medications? This is something many people are unaware of. That's right, grapefruit contains compounds called furanocoumarins. These compounds interfere with an enzyme in your gut responsible for breaking down many medications. This means that when you eat grapefruit or drink grapefruit juice, your body absorbs more of the medication than it should. This can be particularly dangerous. This can lead to dangerously high levels of the drug in your bloodstream, potentially causing serious side effects. It's a hidden risk that many people don't consider. One of the most well-known interactions is between grapefruit and statins, medications used to lower cholesterol. Statins are commonly prescribed, making this interaction particularly concerning. Grapefruit can increase the levels of statins in your blood, which can lead to muscle pain, weakness, and even a serious condition called rhabdomyolysis, which can cause kidney failure. This is a severe and potentially life-threatening condition. But it's not just statins. The interaction between grapefruit and medications extends to many other types of drugs. Grapefruit can also interact with a wide range of other medications, including blood pressure medications, antidepressants, anti-anxiety medications, and even some cancer drugs. This makes it crucial to be aware of what you're consuming. The good news is that not all medications are affected by grapefruit. However, the list of those that are is extensive, but the list is long enough that it's always best to err on the side of caution. You don't want to take any unnecessary risks with your health. Always check with your doctor or pharmacist before consuming grapefruit or grapefruit juice if you're taking any medications. They can provide you with the most accurate and personalized advice. They can advise you on whether it's safe or if you need to avoid it altogether. This simple step can prevent serious health issues. Remember, even a small amount of grapefruit can cause interactions, so it's not worth taking the risk. It's better to be safe than sorry. Up next, we're tackling a fruit that's often touted for its health benefits, but it can be a silent danger when mixed with certain medications. Stay tuned to learn more about how to keep your diet and medication regimen safe. Pomegranates are often praised for their antioxidant properties and potential health benefits. But here's a word of caution. If you're taking blood thinners like warfarin, you need to be extremely careful with pomegranates, especially pomegranate juice. Pomegranate juice contains compounds that can interfere with the way your body metabolizes warfarin, making it less effective at preventing blood clots. This can have serious consequences as it increases the risk of dangerous blood clots forming, which can lead to stroke, heart attack, or pulmonary embolism. But it's not just blood thinners that pomegranate can interact with. It can also affect medications for high blood pressure, potentially causing dangerously low blood pressure. So, if you're taking any kind of blood thinner or blood pressure medication, it's crucial to talk to your doctor before adding pomegranate to your diet. They can assess your individual risk and advise you on whether it's safe for you to consume. Remember, it's always better to be safe than sorry when it comes to potential food-drug interactions. Now, let's move on to another citrus fruit that can cause unexpected problems when mixed with certain medications. Oranges, like grapefruits, are a great source of vitamin C. This essential nutrient is vital for maintaining a healthy immune system, aiding in the absorption of iron from plant-based foods, and promoting healthy skin. Many people enjoy oranges for their refreshing taste and health benefits, but they also contain compounds that can interact with certain medications. These interactions can sometimes lead to unexpected and potentially harmful effects, making it crucial to understand how oranges might affect your medication regimen. While not as potent as grapefruit, oranges can still pose a risk for those taking certain medications for high blood pressure or high cholesterol. The compounds in oranges can alter the way these medications are metabolized in the body, potentially leading to either an increase or decrease in their effectiveness. For example, oranges can interfere with calcium channel blockers, a type of blood pressure medication. This interference can prevent the medication from working as intended, leading to less control over blood pressure levels. This interaction can lead to a sudden drop in blood pressure, causing dizziness, lightheadedness, and even fainting. Such symptoms can be alarming and may require immediate medical attention to prevent further complications. Similarly, oranges can interact with statins, medications used to lower cholesterol. The compounds in oranges can increase the levels of statins in your blood, which might sound beneficial but can actually be harmful. This interaction can increase the levels of statins in your blood, increasing the risk of side effects like muscle pain, weakness, and in rare cases, rhabdomyolysis. Rhabdomyolysis is a serious condition that can lead to kidney damage if not treated promptly. Now, I'm not saying you need to swear off oranges completely if you're on these medications. Oranges can still be part of a healthy diet, but moderation and timing are key. But it's essential to be aware of the potential interactions and talk to your doctor or pharmacist. They can provide personalized advice based on your specific health needs and medication regimen. They can help you determine if it's safe for you to consume oranges and in what quantities. This guidance can help you enjoy the benefits of oranges without compromising your health. Remember, even small changes in your diet can have a big impact on your health, especially when medications are involved. Being informed and cautious can help you make the best choices for your well-being. And finally, let's talk about a fruit that's often seen as a symbol of health, but can actually reduce the effectiveness of certain medications. Stay tuned to learn more about how to navigate these dietary considerations. An apple a day keeps the doctor away, right? Well, not always. While apples are undoubtedly nutritious, they can interfere with the absorption of certain medications, making them less effective. This is because apples contain a type of fiber called pectin, which can bind to some medications in your gut, preventing them from being fully absorbed into your bloodstream. This means you might not be getting the full dose of your medication, which can lead to uncontrolled blood pressure, cholesterol levels, and other health issues. For example, apples can interfere with the absorption of certain antibiotics, thyroid medications, and even some heart medications. The good news is that this interaction can usually be avoided by simply timing your apple consumption strategically. It's best to eat apples at least an hour before or 2 hours after taking your medication. This gives your body enough time to absorb the medication before the pectin in apples has a chance to interfere. As always, it's best to talk to your doctor or pharmacist about any potential interactions between your medications and your diet. They can provide personalized advice based on your individual health conditions and medications. Remember, knowledge is your best defense when it comes to staying safe and healthy. So there you have it, 5 common fruits that can have surprising and potentially dangerous interactions with your medications. Remember, this is not an exhaustive list, and it's always best to talk to your doctor or pharmacist about any potential interactions between your medications and your diet. They can provide personalized advice based on your individual health conditions and medications. Knowledge is power, and understanding how your food and medications interact can help you make informed decisions about your health. Don't be afraid to ask questions and advocate for yourself. And if you found this video helpful, please share it with your friends and family.